Assalamualaikum warahmatullahi wabarakatuh, and hi, my name is Nur Aina Shaira binti Hussein with metric number 055456, a student of Bachelor in Medical Imaging at University Sultan Zainal Abidin, and today I am your radiographer. Do you hear that sound? An ambulance siren. Oh my god, I think we have a case now. So let's follow me to handle that case. Okay guys, just now a polytrauma patient came to medical imaging department with a trolley for further investigation, and the doctor in charge asked me to do a lateral femur projection. Remember, the patient is the polytrauma patient. That means we need to minimize patient movement since she can move a lot, or else her injuries might become worse. So for the lateral femur, we will use 35 times 43 cm of cassette size. And don't forget your marker. Actually, for trauma patient that come to radiography department, first thing first, radiographer need to obtain lateral cervical projection first before do another projection. So after the lateral cervical, we move to the lateral femur projection. Let's go! For your information, the lateral femur without modification technique, usually radiographer will put cassette under patient femur, like this, which is the patient is in the lateral recumbent position with affected side down with flexed knee to 45 degrees. We can see that patient need to move a lot to obtain this radiograph. But for this case, the patient is the polytrauma patient. She's on the trolley, so we just proceed the projection by doing it on the trolley. So the modification technique that I use is by doing a cross-table lateral femur, which is a lateral medial horizontal beam projection. So we assume that patient on the trolley and in a supine position. Firstly, I will place support under affected leg and knee to center the leg and knee to IR. I asked help from another radiographer to help me lift patient leg in proper method of lifting lower limb for the placement of the elevation block. Then, I will place IR on edge against medial aspect of the thigh to include knee, with horizontal beam directed to lateral side of femur. Please note that the cassette is being held by cassette holder. The marker is placed in the collimation area without superimposed with femur. And also, don't forget to place the gonad sheet outside the region of interest, and I support foot and ankle in true epi position by using sandbag, and the projection will be shoot as a direct shoot since the patient is on the trolley. And the final patient and part positioning will be like this. CR is perpendicular to femur and CR directed to the midpoint of IR. And I also will make sure that the SID is 100 cm. The collimate is closely on both sides to femur and with end collimation to IR borders. So, why I use this modification technique? It is because the patient is the polytrauma patient. She can make a big move and also she's in a lot of pain. If we use normal lateral projection without modification technique, patient need to move a lot. Remember, in handling trauma cases, we should position the X-ray tube and the IR rather than the patient, so the patient condition not going to be worse. Why I do it on the trolley, not on the table bucky? Because if we do on the table bucky, we need to transfer patient from one bed to another. Patient will be in a lot of pain since she is a polytrauma patient, and at the same time there is a movement and any complication might be occurred. Why I place support under affected leg and knee? It is because to center the leg and knee to IR, so no cut-off of image will occur, so we can see the whole femur in the image. So we do lateral medial horizontal beam projection because this modification technique is positioning an X-ray tube and IR, not the patient. So the patient do not have to move much, and especially if there is an immobilization device such as neck collar or any wire or tube, it will make it harder for patient to move if we use normal projection. And next, I will show you the radiograph image of lateral femur. This is the normal radiograph of the lateral femur, As you can see, there is no pathology in the radiograph. And this one is the abnormal radiograph of lateral mid and distal femur. X-ray shows a transverse fracture of the femur. The break is a straight horizontal line across the shaft and no other pathology detected. So, that's all from me. I am Nur Aina Sherabetusen, your future radiographer. Thank you so much and see you next time. Bye!